Hello, good day everyone. My name is Agatha Osuji. Welcome to my practice proposal video. My topic today will be on the importance of screening for postpartum depression in our postpartum unit. Land acknowledgement. I acknowledge that we are gathered on the traditional territory of the Treaty 7th First Nations, which include the Blackfoot Confederacy. I pay my respects to their elders, past and present, and I extend that respect to all indigenous people. Conflict of interest. There are no conflicts of interest to disclose. Please take your time to watch and reflect on this video. I can't imagine the magnitude of challenges she experienced as a new mother, dealing with postpartum depression and lack of support from her healthcare providers, and the community must have been a tough one. Watching her story reminded me of my own struggles after the birth of my second child. I believe that mental assessment questions from Edinburgh Postpartum Depression Scale, or even from rapid assessments or 2 Willy questionnaires, would have helped her open up about her symptoms, and which might get her the help she needed. Jean et al. 2019, in their study published in the Journal of Perinatal and Neonatal Nursing, showed that early screening for postpartum depression helps to identify those at risk for postpartum depression and get them the necessary support. I am passionate about supporting new mothers, especially in minority communities, where these issues are often overlooked due to the language and other cultural or religional barriers. My goal is to create a safe space for people to be heard, seen, and cared for. Her study highlights the importance of healthcare providers to be attentive and proactive in addressing postpartum mental health issues. No new mom should suffer in silence as she did. These are my objectives. One of the key issues I aim to address is the significance of early postpartum depression screening for our new mothers. Rather than waiting for the 1 week postpartum screening at public health child clinics, it is crucial to implement mental health screening for our patients prior to discharge. I am providing this informative YouTube video to highlight the importance of postpartum screening. This initiative is designed to inform my co-workers, clinical instructors, and my manager on the impact of postpartum depression and the necessity for screening during postpartum admission. Postpartum depression poses a significant risk to both maternal and child health and should not be underestimated. With the prevalence of postpartum depression ranging from 3 to 19% in various populations, early screening is essential, as highlighted by Liu et al. 2021. My primary goals are to elucidate the effect of postpartum depression on mothers, stress the advantages of early detection, and integrate the screening tools during postpartum admissions. Therefore, this educational initiative aims to address the critical aspects of postpartum depression screening and emphasizing on the importance of early screening. These are my agenda for this proposal. Kroska and Stoll, 2020, reported that postpartum depression affects up to 15% of new mothers, with symptoms include anxiety, sadness, mood swings, feeling of overwhelmed, and difficult bonding with the baby. Risk factors for postpartum depression include a history of depression, previous history of postpartum depression, pregnancy complications, financial constraints, and domestic violence. Failure to diagnose or treat postpartum depression could lead to ongoing depressive disorders, affecting the mother's ability to work and participate in activities, ultimately impacting the economy. Furthermore, children of untreated postpartum depression mothers are more likely to experience developmental difficulties, behavioral disorders, and psychological issues. This is according to Liu et al. 2021. To address this issue, I am embarking on creating this educative YouTube video to increase awareness of postpartum depression screening among my work team. The Edinburgh Postpartum Depression Screening Scale, EPDS, is commonly used to screen mothers during pregnancy and postpartum. It consists 10 questions that assess mood and emotional well-being, with scores ranging from 0 to 3. A score of 10 or higher may indicate possible postpartum depression and may also warrant further evaluation and support. While the Edinburgh Postpartum Depression Scale is widely used tool, some staff members may express concerns about its time-consuming, especially given their busy work schedules. This is why quick assessments like rapid assessments and Wiley questionnaires are another valuable alternatives. These tools consist of just 2 simple questions each, making them easy to administer and provide a quick snapshot of person's emotional status. Rapid assessment involves asking 2 straightforward questions to assess emotional health. The first rapid assessment question is: number 1. In the past month, have you lost interest or pleasure in things you usually like to do? Number 2 rapid assessment question: have you felt sad, low, down, depressed, or hopeless? Again, the 2 Wiley questions are: number 1. During the past month, have you often had little interest or pleasure in doing things? Number 2 Wiley assessment: during the past month, have you often been bothered by feeling down, depressed, or hopeless? By incorporating these alternative assessment questions, which are rapid assessments and Wiley questionnaires, into mental health screening, healthcare providers can quickly identify potential issues and provide timely support and intervention to the patients before they are discharged from the hospital. This can help in preventing the negative consequences of undiagnosed mental health conditions like postpartum depression. Importance of postpartum depression screening. A study published in Journal of American Medical Association by Grace Smith et al. 2021 found that screening for postpartum depression during postpartum admission can help identify women at risk and lead to early intervention and treatment, resulting in improved outcomes for mothers and their babies. Hence, it is important to assess new mothers for postpartum depression during their postpartum admissions rather than waiting until 1 week after delivery as currently recommended. Also, after discharge, new mothers are often overwhelmed and exhausted, making it difficult for them to accurately report their symptoms if assessed at a later time. They may downplay or dismiss their symptoms as normal stress from childbirth. Early detection and treatment of postpartum depression, as highlighted by Carrasco and Stoll 2020, are crucial in preventing the condition from worsening at home. Additionally, early detection facilitates mother-infant bonding and attachment, reduces stigma, enhances overall quality of life for mothers and their families, and supports community well-being and economic productivities. My planned activities. The reason for sharing this video to you, my work colleagues, is to facilitate a discussion on postpartum depression screening, the risk factors, and the symptoms of postpartum depression, fostering a better understanding and recognition of the condition. After watching this video, I encourage each of you to take a moment to reflect on those patients who displayed signs of mental health concerns during their stay in the hospital. What specific factors made you worried about them? Were you able to assess their mental health before they are being discharged from the hospital? If yes, how did you ensure they received necessary support and care they needed in the community? I have created a survey in the next slide to gather your feedback on the effectiveness of these educational interventions, what you have learned, and which assessment tools you believe is most suitable for evaluating the mental health of our postpartum mothers to prevent undiagnosed postpartum depression. Your own input will guide us in making adjustments for future intervention and support for our postpartum patients. These are my mini evaluation I will want you to complete for me. Please take a few minutes to complete the above 6 survey to provide me feedback on my YouTube video. Your input is valuable in helping our unit to improve our screening for postpartum patients. Thank you for your participation and your feedback. Your ideas and input will help us enhance our effort in promoting maternal and child health through effective screening and support for postpartum mothers. Thank you once more. These are my references. Thank you again for your time. I will include the link for Edinburgh Postpartum Depression Assessment Scale, Rapid Assessment Questions, and Wiley Assessment Questions under my YouTube video. Thank you once more. I appreciate your time.